Hello everybody, my name is Mina Beckett. I'm a PGY3 at FAU internal medicine program. Today I'll be talking to you about my case report. It is titled Beyond the GLP-1, a silent creatinine rise reveals a 34 centimeter pelvic mass. So this case involves a 59-year-old female who was being followed in our clinic regularly for diabetes and hypertension control, and started developing progressive kidney dysfunction with a creatinine rise from 0.97 to 1.95 in the course of a few months. This patient has a history of diabetes, and she was on oral semaglutide Rybelsus, and we were uptitrating her medication in order to achieve better weight loss. The patient had no abdominal symptoms and tolerated the Rybelsus exceptionally well, and the AKI that we discovered was not accompanied with any GI or any flank pain or any other symptoms. We encouraged her to drink more fluids and eventually decided to discontinue the Rybelsus in order to monitor her kidney function, which still did not improve. So further workup of the AKI, specifically renal ultrasounds, revealed a cystic mass in the abdomen, which on CT abdomen pelvis was discovered to be a 34 centimeter pelvic mass at an axial in origin. The patient eventually underwent resection of this mass, which was fortunately benign in pathology. However, this case brings up a few teaching points, namely that although semaglutide and other GLP-1 agents are involved or are well described to cause acute kidney injury and progressive renal dysfunction, this is typically in the setting of nausea, vomiting, volume loss, and dehydration. And the atypical presentation, in the absence of these symptoms, should and did prompt, further workup for AKI. Additionally, that the patient had no symptoms of this presumably slow-growing mass, and was, it was discovered to basically take up her whole abdominal cavity. And so this case highlights the importance of close monitoring for kidney dysfunction, especially in patients with multiple comorbidities and obesity. And it demonstrates that a barred differential should always be included, even when culprit medications confound the picture.